Hello, my name is Elizabeth Koscielny, and I am currently an LPN-BSN student at the Indiana State University in Community Health Nursing. Today we're going to be doing a population at risk, and we're going to be focusing on prenatal and maternal health among incarcerated women. Alright, so first I would like everyone to pause the video, and you're going to go down to the bottom where the pretest is located and take the pretest to test your knowledge. And then after we go through the presentation, I'll ask you to take the post-test, and then you'll compare how much you've learned through the presentation. So first, our learning objectives. The first is to identify the rates of incarceration among women in the U.S. Second, we will define the impact of the Sentencing Reform Act. Third is to identify the rates of pregnancy among incarcerated women. Fourth is to understand dangers associated with current institutional policies when applied to pregnant women. Fifth is to acknowledge negative outcomes that are associated with these current policies. Sixth, we will explore available programs and resources that aid pregnant women currently incarcerated. And finally, number 7, we will identify resources and pathways that we ourselves can become an advocate for this vulnerable population. So first, to start, the incarceration of women within the U.S. Currently, we have the highest rate in our national history of incarcerated women. We also have the highest female population out of the entire world. Out of the 714,000 women that are incarcerated worldwide, 212,000 of these are in the U.S., accounting for a 30% rate of incarcerated women in the U.S. From 1980 to 2010, the rate of incarceration in the U.S. rose by 646%. The majority of the women that have been incarcerated are typically nonviolent and drug-related offenses, and this is primarily related to the war on drugs. An associated legislative act with the war on drugs is called the Sentencing Reform Act, and it was passed in 1984. Basically, this limits a judge's ability to consider incarceration on a case-by-case basis, which includes pregnancy and motherhood, which basically means that if a woman commits a crime associated with drugs, the judge has to sentence the most appropriate jail time to her, even if she is pregnant. So now to look at pregnancy and incarceration. About 25% of the women that are incarcerated are pregnant or have been pregnant less than a year before their intake. And about 6 to 10% of women are pregnant upon admission into the facility. These women who are pregnant while incarcerated are more likely to be single, be an ethnic minority, poor or low income, a lack of a high school education or diploma, more likely to abuse substances and alcohol, and to experience domestic abuse. There is also an increased risk of complications, both because of their background and their pregnancy and incarcerated. These complications include miscarriages, preterm deliveries, low birth weights, and preeclampsia. So what are some policies currently in jail facilities that pose a danger to pregnant women? The first is the use of shackles or restraints. The use of shackles or restraints are typically applied whenever the patient leaves the jail itself, which during the pregnancy, labor, and delivery can be quite frequently for these women. The shackles increase their risk of injury from falls. It impairs healthcare professionals' assessment of emergent conditions as well as adequate treatment, and it also impairs that mother-child bonding immediately following delivery. Currently, U.S. obstetric and gynecological organizations recommend certain standards of care. These include prenatal screenings, a special diet, drug rehabilitation services, continual access to the newborn for the mother, and limiting the shackle use. However, there's no state law or any mandatory requirements for these recommendations, so unfortunately it varies based on institutions whether these are provided. And the majority of these facilities require relinquishing the infant to another caregiver shortly after delivery. This separation between the mom and the infant has several negative outcomes. It increases the risk of postpartum depression within the mother, and for the child, it also increases their risk of developing anxiety, a sense of insecurity, causes social and academic delays and challenges, and can lead to substance abuse in these children. Sometimes it can even lead to incarceration when they are older. The correctional policies that are in place today were created when pregnant women were rarely incarcerated, and they're more applicable to their male inmates. Unfortunately, there's very little research and public information available on this topic. The only national estimate of births while incarcerated is from 1998. Several authors estimate this to be because the jails don't really want to publicly acknowledge certain policies that they are or are not doing. So what are some programs that have been put in place to enhance prenatal care? So far, 21 states have banned or limited the use of restraints and shackles during pregnancy, labor, and delivery. Prison nursery programs, which allow for the infant to remain with the mother during her incarceration, have been shown to create a strong relationship between the mother and infant and positively affect both. It also helps to break the cycle, leading to better attachments for the child and a better outcome overall. The Women and Infants at Risk program, or WIAR, allows for low-level nonviolent offenders to be moved to a secure community facility for the third trimester and their birth. And programs that allow a doula for emotional support and advocacy during pregnancy and delivery have been shown to decrease the risk of complications and the development of postpartum depression. So how do we move forward from here? Well, more research and public information is needed from these institutions to understand the disparities and difficulties that pregnant women face while incarcerated. There also needs to be a development as well as an implementation of state legislation for standards of care for pregnant women incarcerated to make sure that it does not depend on each institution. We also need to decrease the stigma associated with incarceration. This stigma has been shown to be the most fundamental barrier for health, education, economic equality among the incarcerated. It has also been shown to cause a lower intention to provide the appropriate standard of care for maternal and prenatal support within healthcare professionals. So, what are some resources that we can do to help us with this? Well, the American Civil Liberties Union provides contact information for lawmakers and legislators, as well as other important information. The American College of Obstetricians and Gynecologists is also a good resource. The CWLA Advocacy Center provides current policies and resources, and www.congress.gov actually gives a listing of all the state legislators, both at the state and national levels, that you can contact and become an advocate for this vulnerable population. These are my references. And now I'd like you all to go to the bottom and take the post test to see how much you've learned. Thank you so much for listening today, and I hope you've learned a great deal.